Hello and welcome everybody. Thank you so much for joining us today. My name is Dr. Marco Duguay, and today we're going to be talking about the top 5 veterinary emergencies. So what to do, what to expect, and kind of how to get care. So just to give you a little bit of a kind of personal introduction here, my name is Dr. Marco Duguay. I'm a veterinarian, graduated from Atlantic Veterinary College in 2021. This is myself on my graduation day with my lovely fiance, Mary. These are our 4 cats. We love them very much. And in fact, we added a 5th cat to the mix just this year. So we're really excited about that as well. To give you a little bit of kind of information about me from a professional perspective. So graduated in 2021, dived into emergency and 24-hour medicine pretty soon after that. Learned lots while I was there and became co-founder of the Veterinary Urgent Care Group in October of 2023. Some of my special interests in general, really love surgery, really like imaging, so x-rays and ultrasounds and that kind of stuff, as well as kind of analytics and statistics, about the veterinary industry, about business and all that kind of fun stuff in general. Give you kind of a little bit of a introduction to what the Veterinary Urgent Care Group is in general. So getting an idea of our purpose. Big one is returning veterinary medicine back to veterinary professionals. So all of our clinics are kind of owned, operated by the veterinarians that are part of the group, as well as the staff members, the service representatives, the assistants. Everybody kind of plays a key role. Managers, everybody kind of has a piece of that company and bringing back to the veterinary community, as well as improving access to pet care for owners when and where they need it. So not 2 weeks from now, not when all of the funds are there, just when they need it, where they need it, and exactly what they need. What do we do at the Urgent Care Group is pretty much whatever we need to. We can do surgeries, we can do diagnostics, we can do medical care. If we need to, we can refer to 24-hour facilities, we can refer to specialists, get that kind of stuff done. And we can see same-day appointments pretty much every single day. We're open 12 to midnight, 7 days a week, 365 days a year, holidays included, at 4 locations across Atlantic Canada right now, and so many more to come. We're in Quispamsis, we're in Riverview, we're in Fredericton, and then we also have a clinic in Charlottetown, PEI. There's a picture of our Charlottetown clinic. It's our CEO, Ivan Zach, and our managers, Sarah Hall, as well as Lindsay Mosher. In the Urgent Care Group, to give you a little bit more information, we do have some interesting initiatives as well. So there's a few things that we are working on, including payment plans is one. So when I say, where and when you need the care, we do have an option for payment plans for those who need it. Really useful when, money is tight sometimes for veterinary situations. We have in-house plans that don't require credit checks. There are a few criteria that you need to meet, but those are awesome. Dr. Cody Burke is kind of offers oncology services at our Quispamsis location. That was really fun. He did the very first webinar for us actually a few months ago, and that was really entertaining, as well as, webinars like this one, top 5 pet emergencies that we see and what you should do. Community outreach and information, I think, is so important. So really interesting and something that we love to do. Case communication through Facebook. So giving owners kind of a neat little insight into some of the cases that we see, give them some information on what they can do about them. We also partner with the NBSPCA to offer low-cost spay and neuter clinics at all of our clinics once a month, I believe. Dr. Ellsworth, who's pictured here, kind of runs that. Then I love our spay or our Pause on Discovery Day is basically an event once a year we'll do at each clinic that allows young kids to come in, bring their stuffies, or aspiring veterinarians to bring their stuffies in. We do a whole bunch of diagnostics on them. We pretend to run blood work. We have some x-rays that we do. Really, really, really fun time that we'll kind of have, and that's been super great so far. Just a couple of tips for, going to the vet in general. So general urgent care tips when you are coming to see us, bring as much information as possible. I cannot highlight how important this is. Always really nice to have the primary owner present. If you can't make it, please be available or on the phone or something so we can get as much information from you as possible. Take videos or photos of any collapses or seizures or any possible toxins. Those can that information can come so in handy when we're trying to identify what a certain episode or toxin is. And the medical records and vaccine status, all of that stuff is really important. If you can bring that with you when you come to see us, super helpful to us. Tough topic, but financial preparation is so important as well. So, pet insurance, Trupanion is a company we work really close with. We do direct billing through them, can help lighten the financial burden of having an emergency, as well as just a personal pet fund. Some people set some aside if you don't necessarily want to do the insurance route, but having some amount of financial preparation when you have a pet is super important for any kind of vet visits. And then knowing your pet, so how they behave at the vet clinic. Do they need a muzzle? Are they anxious? Are they extra friendly? Are they, do they work better with us out back when the owners aren't there? Some dogs and cats will actually be a lot better when the owners aren't around and less protective of them, as well as, if maybe they're just better in the room with you, and that's totally fine. One of the last pieces, general tips, is just understanding our limitations as well. Veterinary medicine is amazing. We can do a whole bunch of really cool stuff, and I love the job that I get to do every day. But we do have limitations to some resources of what we can do. Obviously, much more difficult to have access to things like MRIs or, CAT scans might be, especially in Canada when we're paying out of pocket for that kind of stuff, can get quite expensive. So understanding that there's limitations to what we're able to do in general in vet medicine sometimes, although it can be pretty darn incredible what's available out there these days. To get into the bread and butter of everything here. So the top 5 veterinary emergencies that we see in the urgent care group, basically gonna list through them, give you a little rundown of what the presentation is gonna look like, and we'll kind of go from there. So first and foremost, toxicities, things that you might find around the house, in the yard, that your pets can get into, anything from common house plants all the way to medication and toxins and all that sort of stuff. Foreign object ingestions, so those toys that dogs like to play with, or earplugs that cats like to kind of chew up. Trauma can come from tons of different sources. We'll talk about that for sure. All the different types of respiratory distress, again, there are plenty that we'll go over. And a quick touch, if we have the time, on urinary tract obstructions, because we have been seeing tons of those in urgent care recently, and it's something that's really important to talk about because there's some things that you can look for to try to help in those situations as soon as possible. Basically, for each topic, we're going to do a little bit of a kind of overview in general, and then talk about prevention of that item, and then talk about what you can do as a pet owner in those moments of need, and then what we're going to do at the clinic when you bring them in. So give you kind of a rundown of each kind of condition. So for toxicity, give you a little overview. Most common, what you're going to actually see throughout the presentation here is some things are cat or dog specific. You'll see a little kind of cat emoji on the ones that are cat specific, a dog emoji on the ones that are dog. We didn't parse through that for toxicities because, my goodness, there's so many, and most of them are going to be toxic to both. So keeping an eye on human medication like Tylenol, Advil, there's stimulants, there's antidepressants, there's tons of things that can have a really big impact on your pets. Non-prescription drugs, so marijuana, cocaine, nicotine is one that people actually underestimate. So little cigarette butts can actually do quite a bit of harm to smaller pets for sure. Plants like lilies, Japanese yew, there's tons of other plants that are toxic. Plants are tricky because there's a really broad range of toxicity on those. Certain types of foods, as you guys know, chocolate, onions, garlic, the big ones, and then ingredient specific in some of those things as well. Xylitol is a super commonly missed one. It's in a lot of sugar-free gum or sugar-free candy, and it's actually one that can be quite toxic very quickly. So it can drop your blood sugar in a little under 10 minutes for cats and dogs. So really important to remember that. The severity of the condition can range, a huge range. So, some things are mild, and Google might tell you that, yes, it's toxic, but it might mean just a little bit of irritation to the mouth, some drooling, and nothing crazy. But it also might just say toxic, and it could be something that could, shut down vital organs. Like a lily is really toxic to cats' kidneys. And I find often Google and the internet doesn't always specify how toxic something is. It's really important to keep in mind that the range of toxicities that can happen are great. Onset time is really important. Like I said, with something like xylitol, it only takes about 10 minutes to start having an effect. So really, we need to be careful with that onset time. The sooner you kind of get care, the better. Big factor, obviously, different weights, different species. These two patients are going to react so differently to different toxins because one is tiny, one is huge, different species. It can all have an effect on them. And then when it comes to cost, I'm trying to give you guys a little bit of a breakdown of kind of how the cost can vary amongst these different conditions. Not to give any specifics, because every clinic is going to have slightly different pricing, and every condition and case is a little bit different. But again, toxicities will vary a lot. You can have your just minor things that we might just have to add some antacids and things to protect the stomach lining. Those can be fairly, reasonable appointments. But you could have those lily toxicities where they need really aggressive care. They need hospitalization or something a little bit more aggressive. And those can be quite a bit more expensive. For prevention, so what can you do? The easiest thing to do is just don't have them accessible. So they can't ingest what isn't there. Use Google Lens or Picture This to identify any plants, bouquets as well. It's really easy to just get a nice bouquet of flowers and not to look at each individual one. It's also really easy for your cat to pick that one to chew on that is toxic. If there's any doubts, it's best to throw it out or not bring it home. And don't forget to check your gardens, your yards. There's tons of stuff that can be out there that could be toxic as well. Limiting access, super easy. So hanging plants really high up on a good sturdy hanger. Plant cabinets like this one, you can get these at IKEA or any type of kind of furniture store. Locked medicine cabinets, keeping toxic foods on high shelves. That kind of basic stuff. Basket muzzles are one that I'm pretty passionate about, because they have saved some of my clients thousands of dollars, not just when it comes to toxicities, but also foreign bodies. We'll get to that too. But it doesn't mean that it's a mean dog to have a basket muzzle on. It just means, hey, they're prone to, picking stuff off the ground. If you're in an unfamiliar environment, it really doesn't hurt to have one. Get your dog used to it. Make them know that it's not a punishment or a bad thing. It's just part of going on walks in unfamiliar places. Proper disposal as well, obviously so important for anything that might be a toxin. Disposing of your medication at the pharmacy, making sure that your cigarettes and joints aren't laying around or that they're not thrown on the ground where they can be picked up by your new puppy, and then locking your garbage cans or bins or anything away where they can't get into them. So for you, what should you do in the event of a toxicity? The number one most important thing before we even kind of get into it is immediate care is key. Saw my cat chewing on a leaf this morning, straight to the vet, versus if you saw them chewing on it 5 days ago and we've waited until the clinical signs have started, the prognosis in those two situations is greatly different, and really, really, really better if you get them in as soon as you can. Some other good tips for you guys would be knowing your dog and your cat's weight. It never hurts to bring them into a vet clinic. A lot of human scales are not accurate enough for smaller pets, like especially cats. It never hurts to bring them into the pet clinic and just say, hey, can we just get a weight today? They'll probably throw it into your file and just have it available for you. It's good to have on hand. Write it on a little card so you don't forget it. Photograph everything. So really important to document and identify anything that they might have gotten into in a toxicity situation. So the more information we have, the better. Try to include the amount that's in it, the ingredients, the label, all really, really important. If you're at all doubtful of what it is, or if you're going to get a good picture, just bring it in with you. We'll have a look at it and try to identify it. This is a really important resource. The ASPCA Poison Control is basically, it's a company that is going to be able to give you as much toxic information as possible. They are an amazing resource with lots of technicians and vets on staff. And even if you're coming into the clinic or going somewhere, going to your vet, their knowledge is really important. They'll give you a case number and you can give that to us, and they'll actually connect us with the specialist and go over treatment options and things, especially helpful for those cases where there's a toxicity or one weird ingredient that we're really not familiar with. It can be extremely helpful. It does cost $90 US, but this can save you a fortune in tons and tons of vet bills if you get prompt care for something that you need to. Only because it's an unavoidable topic, I do want to talk about hydrogen peroxide very briefly, because it comes up a lot when you Google best ways to induce vomiting, or my cat or dog got into a toxin, what do we do? Hydrogen peroxide is useful in very specific circumstances that either ourselves or the ASPCA would advise you when to use it. It's only really when a toxicity is going to hurt your pet before they're able to get to us. Otherwise, it really shouldn't be done, because it's not the best kind of supervised way to induce vomiting. And there's usually some amount of aftercare that you're going to need anyway. It probably shouldn't be used in a way to try to save money or to kind of not have to go to the vet, because 90% of the time you're going to need some amount of follow-up care anyway. It also isn't appropriate in some cases to induce vomiting at all for certain toxicities. So what are we going to do when you get to us? So number one thing we're going to do is compile all the information we can, calculate the doses. Just because something's toxic doesn't mean that it's toxic at every dose. What matters really is the dose. And so Google might tell you something is toxic. It might mean that it's extremely toxic and potentially deadly. It might mean that it's just a little bit toxic and can cause some GI irritation. It doesn't discriminate very well on that. So trying to get as much information and going over the risks with you is really important. Decontamination is the next step. So get as much of that stuff out as possible. So we'll induce vomiting when it's appropriate, or we'll give activated charcoal, which will bind to certain drugs and chemicals and make sure that they don't get absorbed. And then sometimes we'll need to put them on IV fluids. Sometimes they need to be referred where they can have 24-hour care. There's a few diagnostics as well that can be done. So typically with toxicities, especially if they affect the kidneys or the liver, a baseline blood work is going to be really important. So we know, all right, here's where we're at now. How is that going to change in the next 24 to 48 hours? That will really help us quantify the amount of change that we're seeing and can help us understand the case overall. X-rays, sometimes if there's large chunks of the packaging, definitely I've seen a fair share of, toxicities where half the box is gone, and sometimes that's something we need to evaluate as well. Afterwards, additional treatment, protection of vital organs. So if it's a kidney issue, making sure they're getting fluids and certain medications that can protect the kidneys, protect the liver, and referral for hospitalization or monitoring if needed. Depending on the severity of the toxin, the plan will very much change between patients. Moving on to foreign objects. So foreign objects basically meaning anything that your dog or cat is going to eat that is not supposed to be in there and has a high likelihood of getting stuck. So most common things we'll see in cats: yarn or string, foam, earplugs, toys, that kind of stuff. And then in dogs, stuffies, socks are a big one. Squeakers from toys, just chunks of toys in general. Here's a picture of a really nice rock that our good friend Dr. Ellsworth did a surgery on not too long ago. And then some corn cobs as well. It's getting to the summer, and corn cobs are a huge risk in the summer. Severity, they tend to be a little bit more severe when they do become obstructive. So sometimes, there's certain situations where we'll say, keep an eye on things, that can be appropriate once we know what's actually in there and how much of a problem it is. But most of these cases are going to require some degree of surgery and or hospitalization to some degree. The costs for these kinds of things can range. Again, everything's going to be case dependent, but I'll try to give you a bit of an idea. So if there's a kind of a small piece of something that we're just going to induce vomiting to make sure it doesn't get stuck along the way, that's relatively inexpensive. If it's something that we need to do x-rays on or a scope, that could be quite a bit more expensive. Then obviously the more kind of costly services would be a full-blown surgery to get things out. So what can you do for prevention? The number one is easy and pretty common, just the same as for toxicities. They can't ingest what isn't there. So making sure that they don't have access to, bully sticks or chew toys that kind of splinter, and these sharp chunks are really concerning. No small toys with swallowable pieces. Keep yarn and string away from your cats for sure. And be mindful of items like corn cobs or anything with like skewers. We've seen that before as well. So those are the big ones. It's also springtime, so go outside, do a walk with your dog, have a look and see what he's interested out there, what she's interested in out there. Make sure that there's nothing that got into the snow and as it melted is back there just waiting to be a risk for them. Limit access. So if you do have a high-risk patient, this is really important, or high-risk pet, excuse me. Supervised toy access for those dogs that are prone to trying to chew and swallow things. Kennel them when you're going to be away for extended period of times, or getting them to go to a daycare if you're away for a couple of days. Again, we get back to basket muzzles for high-risk dogs. That's where clients have saved probably the most. Is we've had patients where they have had 3-4 foreign body ingestions and eventually have said, hey, listen, maybe throw a muzzle on them when you go for a walk, and it can absolutely save a ton of heartache for your family to have that. And then anytime you're in an unfamiliar area, making sure that you're doing a leash walk for the first little bit at the very least, to make sure that you're familiar with the area a little bit more. Proper disposal, same as your toxicities, making sure that everything is locked away. Garbage cans and compost bins are, have a latch on them that actually lock. And take a little inventory of your toys from time to time. So go through their toy bin, kind of check them out a little bit, make sure that there's nothing concerning there. Sometimes you'll see a little tear. Don't try to save the $40 on that particular toy. I would throw it away. It's not worth the heartache to save that toy. So what can you do if it happens? So don't wait. Again, call us right away. The sooner the better. Some of those things, like I talk about smaller socks and really big dogs, sometimes if it's early enough, we can take more kind of safer and less expensive options like inducing vomiting. And the longer you wait, the higher the risk of something tearing or rupturing in the abdomen that's going to cause major issues and end up really being more detrimental to their health overall. Quick note on hydrogen peroxide, because we did mention in the toxicity section. I myself will almost never recommend hydrogen peroxide for vomiting when it's a foreign object. The risks of aspiration or them choking are just too high. So I tend to not recommend using this at all at home for any foreign object ingestions. It's also important that we understand and know the size and like the texture of the item, because some of that stuff can cause a lot of damage coming back up. So take an inventory again, check on the main things. If your pet's vomiting or having some diarrhea, look around the house. Is anything missing? Check kind of the common areas that they like to play and make sure that you don't see any stuffies like this guy here with half an eye and an ear missing. Make sure that nothing looks like that for sure. Vomiting and inappetence. So looking for kind of clinical signs, abdominal discomfort, if they're not interested in water, seeing any drooling or nausea, changes of their behavior. Keep an eye on that stuff and acting more prompt to make sure that, it doesn't go on for 2 or 3 days before we say, oh, well, maybe he might have eaten something. It's really important to get these guys evaluated. So what we will do, number one thing for diagnostics would be x-rays. I share this image. It's a little bit funny and interesting, but I also share this image because I think I want to clear up a bit of a misconception of what x-rays look like when we're evaluating these patients. So when we think x-rays, a lot of people will think of this and think, oh, they ate something. We're going to do an x-ray and we're going to see it right there. Fortunately, a little dinky car like this is mostly metal and shows up really nicely on x-rays. I'm going to tell you the majority of the cases that we see are actually a lot more similar to this, where mostly normal looking x-ray, not any major concerns. And in this particular case, we were looking at this tiny little kind of density here that was slightly different than the rest, and only really able to evaluate that on multiple views to get the right angles to make the assessment to get in and actually do the surgery. So really important to understand, it's not as black and white, no pun intended, as we might think they are. X-rays sometimes take a little bit of kind of subjective evaluation as well. There's lots of other diagnostics we can do, but x-rays are pretty much the first one we'll recommend with a potential foreign object. Contrast study is this view here. It's when we put like a really opaque material, a really dense material, and we feed it to them. And then we get to watch it on multiple x-rays kind of go through the gastrointestinal tract. It's really nice for identifying obstructions. It can be quite helpful. Ultrasound down here, this was an ultrasound of a kitty with a string foreign object. So this bright line here is the string and the intestines kind of bunch around it. And then blood work is really important as well, because maybe they got into a toxicity at the same time. If we're doing any anesthesia, pre-anesthetic blood work is really important to understand the risks of anesthesia, especially if they're senior patients, really, really important. We're going to assess the situation and try to come up with a plan with you. So I do like involving owners in these decisions as much as possible, going over risks and understanding what the best approach is for each pet. The might be inducing vomiting, like we mentioned earlier. It might be doing an endoscope where they put a scope down the esophagus and take something out of the stomach, or it might just be a surgery where we go directly into the stomach or into the abdomen and make an incision in the intestines, take the object out, sew them back up and get them kind of ready to roll. Yeah, that kind of falls under the treatment as well. Sometimes we'll do a bit more of a conservative approach. If we're not 100% sure, if we have one of those x-rays that's a bit more wishy-washy, we'll do fluids and repeat x-rays a few hours later, maybe the next day with owners, coming back the next day, lots of little things like that. Most of the time we'll need some anti-nauseas, some things to protect the stomach lining if we're doing that, as well as antacids too. Trauma is our next one. So kind of a general topic for trauma, because there's tons of things that can cause trauma in pets that we might need to assess. So the most common things, bite wounds are a really big one. Lacerations, so cuts and scrapes on any type of like sharp surface. A lot of the time it's fencing or a broken glass outside. Porcupine quills, this poor little guy up here definitely got the worst end of a porcupine, unfortunately. Orthopedic injuries, again, this might be a little bit of an extreme example, but fractures, dislocations, anything like that. And on the really extreme end, pets getting hit by a car, unfortunately, it does happen. And those are one of our kind of major emergency kind of trauma situations. So severity, I mean, this one again can range greatly. Something like a hit by car might be more severe. Something like a sprain or a dislocation or a laceration might be a little bit more on the mild side. Really important thing to note for these kinds of things: wound size does not always equal severity. So we think about, I have absolutely had those cases where the dog's limping, but not so much. We say, well, you probably should do x-rays. Maybe we do x-rays, maybe we don't. And then you do take an x-ray and you're like, wow, there is a fracture there that, they were just really powering through. The resilience of dogs and cats can impress me some days. Also, puncture wounds too. So small little puncture wounds that might look on the surface to be about this big can definitely sometimes have a lot of underlying tissue and damage. Some infections can develop under there, and it can be quite severe as well. And then costs. So for lacerations or bite wounds, a lot of them do need sedation, so they don't tend to be the cheapest situation, but kind of more of a middle of the road. Any of those like orthopedic trauma, so a leg that looks like this, or hit by cars, those ones can get really costly. So if you need to be referred for orthopedic surgeries, those tend to be a little bit more on the costly side. The lacerations and the bite wounds and stuff tend to be not too bad, but they will need sedation. Prevention. So kind of a tricky thing, but trying your best to maintain, less access to things that can cause trauma. So leash walks or just being leashed in general is really important. As well as just having proper fencing in your yard if you're going to leave them wander off leash. For cats, it's a little trickier because you can't really leash a cat, and you can't really, well, you can. You can't really like fence them in and keep them there. I am a huge fan of catios, so I've built some for my cats before. Really big fan of that because it lets them go outside, enjoy the sun, but not really get into any possible kind of trauma situations with no vehicles or anything to cut themselves on or anything like that. Know your neighborhood. So when you're doing your first walk around your neighborhood with your new dog or your new cat is going out for the first time, walk around with them and have a look, see if there's any chain link fences that are like broken or potentially going to scrape them. Watch for kind of high traffic areas. Try to do your walks more away from those. Keep away from, neighbors you might know have dogs that they keep off leash all the time. Take a different walk the next time and kind of try to avoid that area in general, just to try to minimize those altercations. Setting up friendly visits with your neighborhood dogs is actually a really good thing to do as well. Just to try to get them familiar with each other and that they're not going to end up kind of being territorial when you're walking by. Last important note too, again, check your yards. We've already talked about that, but breakaway collars for cats are super important. If you're leaving them outside, making sure that their collar does snap away. They just can get snagged on stuff, and you want to make sure that they don't have any trauma to their neck when that does happen. Training actually is really important too. So recall is going to be one of your main things that probably a lot of owners overestimate their dog's ability to come back and their heel command. So making sure that your dog has a really strong and really reliable heel command is super important. Test it not only in a nice, calm, comfortable training setting, but test it when he's running after another dog or when he's running, around the yard and kind of going crazy. You'll probably find that maybe it's not as reliable as you think it is, and you might need to work on that a little bit. So what should you do in the event of trauma? Number one thing that helps us at the very least is just staying calm and having clear communication with our team. A phone call we get very often actually is, hey, my dog just got injured. I'm coming in right now. I'll be there in 5 minutes. Hang up. if you can, call us when you're in the car. If we can set up a file for you, we can get a plan together, we can get more information from you to understand what we need to have ready. That can save really, really, really critical moments to try to get everything set up as needed. And the more we know, the better we can help. Really important to assess the basics. So assess their respiratory effort and their respiratory volume. Are they taking really big breaths with lots of abdominal effort? Are they taking really kind of short breaths with not much effort, but also not a lot of volume? If there's any major bleeds, apply pressure with any type of kind of bandage or anything like that you can to stop that bleeding. If you have someone that can come with you so they can maintain pressure on that while you're driving, even better. A big one is to check the mucous membrane color. So I've got a good picture in a few slides of their gum color and what it should look like versus what it might look like if they have internal bleeding of some sort. And then minimize mobility on any fractures. So, we don't want them walking around on something that might be fractured. If you can and are able to carry them in, if not, try to kind of discourage them from bearing weight if possible. A little bit easier said than done, but try your best. The other thing is getting to help ASAP. So adrenaline is pretty crazy what it can do. I have absolutely seen cats and dogs both walking on fractured limbs, trying to kind of tough it out and not show pain, especially when the adrenaline is really high. So not just seeing them, your pup might have shaken it off and is just walking around. You're like, oh, I think he's pretty good. If there's any concern that he might have been injured or she might have been injured, make sure that they get to care quickly. There's also really serious conditions that are super easily missed without diagnostics. Even just when we're looking at them firsthand, there's a lot of the times when you'll need diagnostics to actually identify some of those major concerns. Would be a great idea to take your phone out if you do have a pet. Grab a quick picture of this slide. It's just good information to have in general. So smaller dogs and cats will have a bit of a higher heart rate. It's good to kind of have those numbers. Respiratory rates across the board, usually between 15 to 30. And then temperatures as well, about 100 to 102.5 Fahrenheit. I realize I didn't get the Celsius on this. Generally between 37 and 39 is okay. Anything outside of those range should be kind of assessed as well. So grab a quick picture. I'll leave it for one more second, and then have that just kind of if you need it. So what are we going to do in cases of trauma? There's one thing I want to make sure we communicate to you guys, and it's just don't fear us taking them to the backside of the hospital. Unfortunately, that's where all the oxygen is, all the fluids. Our technicians are trained in appropriate handling to make sure that we can get a good, quick, safe evaluation of them. And if we're coming out to say, hey, we need to take your pet out back right away, chances are that it's just to get as much information because we know how critical they might be and we want to get everything set up for you as soon as possible. Sometimes we'll send a staff member out to give you an update or just to let you know and get some information from you. And then oftentimes once we know the technicians and assistants have their kind of roles and responsibilities laid out, we'll pop in and get some information from you and actually kind of gets talking about treatment and all that fun stuff. Diagnostics in these cases, x-rays are very important for understanding fractures or dislocations or anything like that. AFAST TFAST is a type of ultrasound scan that we do that is looking for any fluid. And that's what you're seeing right up here, which is basically a fluid that's in the abdomen. And oftentimes that's from something like hemorrhage, where something is kind of leaking in there. Pre-sedation blood work, if we need to do some sort of laceration repairs or anything like that, that would be really important as well. For treatments themselves, stabilization, fluid, oxygen, pain medication, and just stabilization of any fractures. Currently, our clinics don't do orthopedic repairs, so we'll usually refer to an orthopedic center. But having a cast on that in order to stabilize it before we send to any orthopedic surgeon is really, really helpful. Final topic for us is going to be respiratory distress. So this, again, kind of like trauma, there's tons of different things that can actually cause respiratory distress. So trying to give you a little bit of a kind of an outline of what could happen and what the cause could be. See, I'm a little bit blurry here for a second. Try to reset my focus a little bit. So common causes for respiratory distress. Again, keep an eye on these little kind of cat and dog indicators. Heart failure, really common one, unfortunately, especially in older patients, but it's not isolated to older patients though. Pneumonia is a common one as well. Collapsing trachea, asthma, choking, and cancer, all very likely causes of respiratory distress. As you can imagine, the severity of that is going to generally be more on the severe side of things, obviously. There are a few chronic conditions that can be mild, but they tend to be progressive as well. So they'll start off mild, but they can certainly get worse as time goes on. Cost-wise, generally not things that we're doing like full-blown surgeries for, but there are definitely procedures that can get a little bit costly in terms of taking fluid off the chest or doing ultrasound or doing x-rays. Some of those diagnostics can get a little bit higher in price, but not so much the actual kind of surgical aspect, which tends to be a little bit of the higher cost items. I'm just going to try one more time here to get this reset. Get that back up a little bit. Sorry about that, guys. I apologize. I don't know why that's doing that. So a couple of things that for respiratory distress worth mentioning is some things can mimic respiratory distress. So we'd call that kind of the great pretender. For example, choking. A lot of the times we'll get phone calls and say, my dog's choking on something. And I'd say a pretty hefty majority of the time, there is no actual choking, and it's just something that kind of mimics that. So anything that can kind of cause a sudden drop in blood pressure, increase in oxygen demand, you might see a significant increase in respiratory effort and rate. Things like abdominal bleeding, so usually from some sort of mass or trauma, will drop the blood pressure, will drop the red blood cell counts in circulation, and you'll see a lot of kind of panting and heavy breathing. It's often accompanied by some degree of weakness as well. Lots of kind of systemic shock, so organ failure, or heat stroke, or hypothermia, toxicities. Those can definitely cause respiratory distress as well. Not exactly what we're talking about in this situation, but also really important to be able to get those diagnosed as soon as you can as well. And so for prevention, again, condition specific. So I'm going to kind of briefly go through these, but we do want some time for questions afterwards. So heart failure, one of the big ones that I would say these days is making sure that they're on a grain inclusive diet. So this is a little bit of a difficult topic because we don't have an exact reason, but the FDA is currently investigating kind of potential links between certain diets and canine heart disease. And so if your dog doesn't specifically have a major allergy or a known allergy or sensitivity to grain, it's usually best to try to find some sort of diet that's grain inclusive, even though that might be pretty difficult these days, because I know it is a direction that some food brands are kind of swaying towards. We're starting to see a little bit more grain inclusive products back on the shelves again, which is really important. The other thing is working up heart murmurs. So if your dog, if your vet notices a heart murmur on exam one day, they might recommend that you go see a cardiologist. It can be something really easy to pass on because there are a decent number of heart murmurs that are physiologically normal, but then there's tons that are actually, underlying heart conditions. It's really important to understand and know those. For pneumonia, making sure you've got the kennel cough vaccine yearly, and making sure that you're working up those coughs early as well. Pneumonia is one of those conditions that can get carried away very easily, and early intervention is key for that. Collapsing trachea is one that is more of kind of a genetic. There are some other pre-existing conditions as well that can cause issues. It's a little bit more difficult to prevent. It's one of those more chronic monitoring kind of things. There's definitely treatments that your vet can administer to help. So just getting those coughs evaluated is really important. For asthma, minimizing allergens and dust, and getting a low dust litter. Toys, choking, very similar to the previous discussion about foreign objects, is checking your toys, making sure that there's not any tears or little pieces that are coming off, and be mindful of those harder foods like carrots and stuff like that dogs might have a bit of a harder time swallowing. Cancer is a tricky one. Again, there's not as many easy tests for cancer. It's a question we get all the time is there a test for cancer? They are working on some blood tests that can actually be really helpful for cancer, but overall, screening is going to be your best bet. So doing things like ultrasound if your vet is recommending it, and making sure that that you're just kind of evaluating them and having them looked at often. Annually, usually, some some places do recommend kind of semi-annual visits, those kind of 6-month visits as well. Yeah. Respiratory distress. So what should you do in these situations? Assess your pet first. So really important that the second you kind of notice any respiratory distress, airway patency is going to be one of the first things, but I also don't want you to get stuck on it. So assessing airway patency is really, really difficult in terms of you've got an awake pet, they're really rambunctious and they're anxious and you're trying to kind of reach back there. Do a quick sweep of the back of the throat. Try to have a look if you can. If you can hear air moving through still and they're still breathing, I would move on to the next thing if they're not actively choking. There's a few good resources for kind of how to keep dogs from choking or how to help with that, that I'll make sure you guys get in a follow-up email after the webinar. But once you've kind of established that, yes, they're still able to get oxygen in and out, move on to the next thing, looking at their respiratory effort, their mucous membrane color. So this is that example, and I've mentioned mucous membrane color quite a bit today, making sure they're nice and pink like this versus that kind of pale color that we're seeing there. That is definitely a major sign. And then assessing your heart rates as well. We sent those, we posted those kind of vital signs there earlier, making sure that the heart rate is within a good number. Keep them calm and comfortable. So anxiety and stress can absolutely exacerbate respiratory illness. So a dog that's in heart failure, that is panicking and anxious and can't settle, is going to be a lot more, is going to use a lot more oxygen than a dog that's nice and calm and comfortable. When to drop everything. So if any of those ones that are above are off, if those aren't normal, getting them to the vet right away. If you notice any sudden weakness or collapse or wobbliness or anything like that, and then basically any new cough or respiratory change should be assessed as promptly as possible in order to make sure that it doesn't have any lasting effects. This one's going to be a little bit quicker. I just made a very brief summary because I could talk for hours and hours about urinary tract obstructions. It can happen in both cats and dogs. It is typically more common in males of both species. But the importance behind this is that patients can become critical very, very quickly. So a blocked cat for even over 24 hours, and even under 24 hours in some cases, can absolutely become critical. So making sure that you catch that really early. Clinical signs would be anything like posturing to urinate or defecate, kind of a hunched position near or around the litter box. Blood and urine can be an early warning sign that they're getting close to being obstructed. And then, you can always come in for an assessment if you think they might be obstructed. We can have a feel of their bladder. A technician can have a feel of their bladder. And if there's no concerns, we can send you away. Or, chat about having a consult to get an evaluation of their urine and making sure that they don't have any kind of lasting conditions there. Usually prevention, especially for cats, a big one is high quality foods. So there's a few kind of manufacturing processes that some companies will take that will kind of minimize the risk of obstruction, and tends to be some of the lower end foods do actually have kind of higher rates of instances of urinary tract obstructions. And it's basically a crystal deposit that they have in their bladder that'll get stuck along the way. There's a varying range of results from supplements. Urinary supplements are tricky because they all have very different mechanisms. Some will kind of adjust pH and stuff, but there's very little regulations around this stuff as well. And so just be really cautious and always follow up with your vet to say, hey, is this something that we should be using? Because it's there are certainly some that are going to do more harm than good, and others that are just not useful, but some are very, very useful. Unblocking in these patients is necessary. So if they can't pee at all, if there's no urine being produced, they do need to get seen right away. That typically requires sedation and in some cases anesthesia if it's severe enough, and passing a urinary catheter in order to try to flush all those crystals and stones back out of the bladder. Some cases will require hospitalization. A lot of the times, especially in our blocked kitties, it's going to significantly improve the outcome or the risk of reobstruction if we hospitalize them and have that catheter in the urethra for actually a couple of days typically. And then I want to take some time to go over a few questions. So what I'll probably do here is stop sharing my screen. I'll pop on here, and oh my goodness, let's try one more time here to to get this back to normal so you can see my face. Sorry about that. So yeah, let's get into some questions here that we've got from, so some people submitted their questions from before. We've also been keeping track of the questions in the chat. So I've got some live questions here. So Stacy said, are there symptoms for the symptoms for toxicities the same for all toxicities? So the answer is probably, it's really no, but also at the same time, there's only so many signs that your pet is going to give you that we're actually going to see. So the toxicities are going to affect multiple different organs for sure. They can affect the kidneys, they can affect the liver, gastrointestinal tract. The kind of interesting thing is a lot of those are going to cause similar symptoms. So drooling, nausea, inappetence. Things like kidney disease, though, will cause more like dehydration. So you can notice like a doughy skin or a really kind of tacky feeling to their skin and their gums. Other ones like rodenticides will cause, bleeding on the gums and the nose, can cause like little spots of blood on their abdomen as well. So there's lots of different kind of signs to look for. Anything kind of abnormal in general is important, but a lot of them will cause some degree of nausea, especially if the kidneys or the liver are affected, or if the gastrointestinal tract is affected too. So yep, definitely similar signs for most of them, but then there's tons of others. There can be neurologic changes, there can be seizures, there can be all those ones as well. Optimistic Pasta said, how to know when a heart murmur is turning into heart disease / should be rechecked. Realistically, you should be having kind of an annual checkup. Oh, we're back in full resolution here. We realistically should be kind of checking with your vet once a year to get annual vaccines, kind of have reassessment there. It honestly is not a terrible idea to have any heart murmur or abnormal rhythms or anything assessed by a cardiologist. Dr. Boutet is a fantastic cardiologist here on the East Coast. And then there's tons of other ones. ABC does have some cardiologists as well. Having them assessed is never a terrible idea. I've got a cat here at home with heart disease who we get checked about once a year just to make sure that things are not changing or worsening. And fortunately for him, things have been going pretty good so far. But it is important to get that assessed frequently. So yeah. So a few things that are just going to be a little bit harder to comment on. So I definitely can't comment on case-specific questions. So, if you're there was some submitted that had really specific questions. Unfortunately, I can't answer those directly without having a proper vet relationship with you. So do get to your vet if you are concerned in any way, shape, or form. Something like an abscess. So VG asked, how do you treat an abscess at home before going to see a vet? Tricky thing about abscesses and bacteria in general, and something to understand about it too, is that the majority of the time they are going to need antibiotics, and most, or not, maybe not most, yeah, I guess most infections are going to need systemic antibiotics. So not just, an over-the-counter cream that you can put on them, especially for abscesses. So there's usually a capsule for abscesses, and the inner part of that is not going to get respond very well to topical treatment, because the concentrations of that antibiotic are not really going to get high enough in those areas. You're really going to need for us to lance it, flush it out, and get some systemic antibiotics. Unfortunately, in those kinds of cases, really, really important. So I've got a couple here as well. So a couple of general questions. One, the big one I did see a couple of times, is how to help a dog that's choking. So there's a few good resources I'll share, but in general, sweeping the mouth left, right, careful not to push back, because you certainly can lodge something further back. There are some good resources online of like Heimlich maneuver procedures. It's hard to show you without a pet. A strike to the back, kind of between the shoulder blades, almost like you would in kind of a baby, being a little bit more firm than you think. A lot of the times I've seen kind of those videos online of people in emergency situations, and one of the biggest things is tend to be a little bit too gentle in those situations. If you're trying to get something out, a good strike right between those shoulder blades, support the head so that you're not kind of hurting their neck or anything like that. Kind of a tricky topic though, because like I said before, the majority of our respiratory distress cases, even the ones that are true like respiratory distress, they're not choking. So it's probably the most common kind of thing that we hear that isn't actually happening is that it sounds like they're choking. I've seen probably 2 or 3 cases of a true kind of choking emergency, while hundreds of respiratory distress, heart failure or cancer or some of those kind of major ones. So don't always go straight to choking, but definitely assess that airway. There was one here, a really good one. I don't have a name with it, but caring for a senior dog. So what are the definite signs that it's time to let him go? Actually really interesting. So thank you for this question, because it may be a good topic for a webinar someday down the road, and something that maybe isn't talked about enough. And something I'm quite passionate about is kind of end-of-life care and what that looks like and what that means. The challenging thing when it comes to senior dogs and cats is there's a range of conditions that can cause a decline in quality of life. And I think at the end of the day, what it comes down to is quality of life. And the unfortunate thing about that is, I would say close to 99% of the time, it is not black and white. So there are very few cases that are the perfect time to say goodbye or the right time to say goodbye. A lot of the times there's more of a gray zone of kind of a, is it appropriate situation to say goodbye? Is their quality of life declining? And having that discussion and assessment is super important, but also taking some of the pressure off the decision of it being the perfect time is really important too. And we could have an entire webinar on that topic, and I would actually love to get into that. So maybe that's a topic for another day, but definitely something that talk to your vet and understand the case completely, but also don't put too much pressure on it being the perfect time to say goodbye. Sometimes that overall just evaluation of quality of life is important. Julia asks, are there any veterinary neurologists in the Maritime? As far as I understand, no. However, AVC does have one that they work with quite commonly, at least the last time that I looked into this. So don't quote me on this, but I believe there was one that they would work with from OVC, from Ontario Veterinary College. We also have a really cool resource through one of the lab partners that we work with that allows us to do referrals to specialists remotely at pretty reasonable costs as well. A lot of like really big neurology or internal medicine or kind of specialty consults can be quite expensive, but because it's an online platform that we directly vet to vet, it can be a little bit more cost effective. I've absolutely worked with neurologists from there. I've had some really interesting cases actually from communicating with the neurologists. So that is a resource that we have available at all of our clinics, that if you are looking for neurology help, I'd be happy to put a referral through and kind of work up that case with you. We've got here on how to figure out proper food serving for your pet. The instructions on the bag can be hard to decipher, plus add soft food and kibble and stuff. That is a tricky one, and you're absolutely right. They can be extremely difficult to decipher sometimes with the recommendations. A few things, if there is a mention of like ideal weight on the bag, definitely consult a veterinarian on getting what like the ideal weight should be when you're doing those calculations. There's also calculations and calculators just in general that you can use online that accounts for the neuter status of your pet, the age, the weight, and takes it all into consideration and will calculate out the calories that they should be getting. And then on the bag of food or the cans of food, it should say how many calories are in that particular bag of food, or in 100 grams. The nutritionists are recommending that you use grams instead of cup. There was a demo at a conference not long ago where they had a kind of a cup of food, and it was trying to measure out 50 grams of food or whatever it was. And the difference that you get between just measuring a scoop is absurd and actually pretty crazy in the long term when you think of it, what you're feeding them every single day, doing like 50 grams over in a really small dog, it makes a big difference. So consult with a vet if you're unsure, but there are definitely calculators online you can use to calculate your dog's or cat's calorie requirements, and then you can base that off the bag of food. For what type of food, I do typically recommend a mix of both wet and dry. Wet just to improve hydration, obviously, and then kibble because I like the abrasion that they'll get on their teeth and helps kind of break down things. you will almost notice when especially a small dog, is only eating wet food, because a lot of the times they'll have a lot more plaque and tartar buildup on their teeth. Let's through a couple more of these questions here. If you do have any more, feel free to throw them into the chat, but there were some ones that were kind of submitted beforehand as well. Can anything be done for fatty lumps besides surgery? That is a tricky one, because fatty lumps are kind of annoying little things that can hang out in our older patients. They're called lipomas, and what that essentially means is it's just kind of a little buildup of fat and overproduction of fat in a small lump that you'll kind of feel on your dogs. Two kind of comments on this. One is I am a huge advocate for sampling and doing cytology on masses. It is pretty easy to feel a lump and say, oh, it doesn't really feel too concerning from an owner's perspective, but from veterinary perspective as well. Sometimes we fall into the trap of feeling it and saying, well, it doesn't look that bad. But I've been surprised before, and I will continue to be surprised for the rest of my career when it comes to finding things if you're looking hard enough. And I do often recommend at least poking those masses once to get an idea of whether or not there's something suspicious. And then if they are something suspicious, removing them. We have tons of resources these days with being able to send slides away digitally instead of physically sending the slides. We can get answers pretty darn quick with some of the technology we have today. In terms of what to be done for them, unfortunately, generally masses removal is going to be the best route. If they're just kind of there and they're benign and you've sampled them and you know that they're not going to hurt them, living with them is kind of just the only real other option that I know of. There may be some things you can do to kind of reduce the rate that they might show up, but there's nothing really that I know of that off the top of my head to help. But really important to get your lumps and bumps sampled and monitored and checking for any growth or anything like that. There's a question about CPR in a feline as well. That could also be an entire presentation too. So I will follow up where there's going to be a follow-up email towards after this to give you some resources that we'd like you to check out. And I'll see if there's any good ones for feline CPR. I did mention, so Kayleen is asking, mention the name of the cardiologist in the area. Yeah, it's Dr. Bruno Boutet is typically the one that I'll use out here. So shout out to Dr. Boutet. He works, I believe, primarily out of Shediac Veterinary Hospital. Typically needs to be something that would be set up with your family vet though. So go through your family vet and they can set up a consult with him. He actually does a lot of travel as well. So he'll travel around to different clinics. A lot of the times your family vet can put you on a list. And when he comes to travel, he'll do an echocardiogram with you. So he's really, really useful. I recommend him to a ton of my clients and get those kind of heart murmurs checked out, because we don't want those getting worse and kind of developing into more concerning things. We've got probably time for one, maybe two more here. Let me scan quickly through. Just a quick chat about, there's a question here, no name on it, but it's just, what about cancer in cats? Is it common, and what treatment options are available? I'll very briefly outline this, but yeah, absolutely. Cats can definitely get cancer, and there's some kind of severe cases we can see from time to time. Gastrointestinal lymphoma is probably one of the most common ones we see. It's cancer of the gastrointestinal tract, so the stomach and intestinal linings. You'll need biopsies for a full diagnosis. There's some signs we'll look for in ultrasound that will guide us to a recommendation of biopsies. In terms of treatment options, it depends. There are some chemotherapy options. In some cases, there are some that are a little less invasive. There's some kind of oral medications for cats that can at least get those cancers under control a little bit better. In terms of just kind of more general palliative care options, sometimes we'll use steroids to just improve general comfort. The problem with that is they will help, but they will only help for so long. But those chemotherapy options are definitely things that you could chat with your family vet about. We also have oncology services at our Quispam Cis location. So Dr. Burke works closely with that referral service through oncologists to come up with a good treatment plan and be able to do all the kind of chemotherapy and all that stuff that we need there as well. That's probably going to be all the time we have for today. I want to thank absolutely each and every one of you for joining today. I really appreciate the support and your interest. And if you liked this one, let us know in the chat there. And I don't think there's a reason we shouldn't be doing more cool webinars like this, trying to get the other doctors on board as well. Dr. Burke, I know, is interested in doing another one as well. So I think it's cool, and I think it's something that we should continue doing. Check us out, guys, if you need us. Moncton, Riverview, Quispam Cis, Charlottetown, and Fredericton. There are more clinics to come later this year, so keep an eye out on our websites and on the news for any new updates, because there's definitely some things coming. I hope you all have a wonderful night, and thank you so much for joining. See you guys.